Simon. It's really a pleasure to be here and discuss in context how all of you are shaping research going into the future. That it's a different place. It's a different way of approaching research ideas and conducting research, and that's what I call sort of patient-oriented research, with the patient or the public at the center of what we do, and bringing together all the types of people to design and conceive the best type of research. So a bit of who we are. The clinical epidemiology program at the Ottawa Hospital consists of scientists. We're up to 87 scientists. This is practically doubled in the last 6-7 years. A ton of clinical investigators, so the scientists are those that have greater than 50% of their time dedicated to research purposes, whereas clinician investigators are nurses and physicians, social workers, etc., that spend a bit of time doing the research, but their focus is really on their clinical duties. Our strengths are sort of 4 Ps, are our purpose, which is practice-changing research. We'd like to either define or change practice and provide that evidence base of what works and what doesn't work for our health system to take on. Our people, our place, and our partnerships. And our partnerships are broad. They're within the city, they're within the province, and within the country. Within the ClinEpi program, I think that our real strength is having expertise in the clinical or health domains, such as emergency medicine, such as nephrology, etc. And then we combine them with our methodological strengths. So we have strengths on both sides of the equation, and actually they're not separate. They act as a matrix, that we bring together all the expertise in terms of the methods and team science approach, which I'll get to in a few slides, and we conceive, design, and execute and transfer our research with this in mind. So it's not silos, it's not individual researchers working on their own, it's this team approach. And part of that is the Ottawa Method Centre. So the Ottawa Method Centre has been around for about 10 years now, and it facilitates that team experience. So we work with researchers to again, build the best research agendas they can, and interesting enough that our core business used to be, stats, study design. Well, this is really broadened, and certainly in the last 5 years, and we're still ramping up to make it more community public friendly in terms of getting the input from all those as part of their health system. That includes patients, includes people with lived experience, includes decision makers, includes just the general public, all involved in the research process. This was unheard of, at least in Canada, and certainly in Ottawa even 10 years ago. So we're changing that landscape. And our philosophy is, again, to assemble the right expertise, so bringing all those that are necessary to build a research agenda, and then assembling the relevant research agenda based on that expertise. So for example, if I was conducting a pragmatic trial or a study in a certain area, it's not just about that trial. There's all the expertise and research agenda you have to build to justify that trial and to ensure that trial is designed and conducted in the best way possible. And what has really changed in the last few years, again, is that partnership with the public and community and those with lived experience. They're having a direct impact in all those boxes. Whether you think that or not, they are. The way we do things, the way we conceive things. I'm a clinical trialist and epidemiologist. The way I think is shaped by other members of that team. including the community and patients. That's a big change from a few years ago. So what's driving this at the Ottawa Hospital? And I say the Ottawa Hospital because that's where I'm based, but it is throughout the community of Ottawa. Certainly at Briere and the Montfort Hospital, they're also embracing patient-oriented research. So putting patients at the center of what they do. Well, they've realized that they can't do anything for the patients without the patients, right? So their perspective matters. Family members matter. Caregivers matter. So we're going from a research-driven focus, those silos, to a patient-centered research focus, and bringing in all, again, that expertise and input from day one. So they're shaping the questions, they're shaping how we do research, okay? As well as there's been a huge recognition by governments and funders, certainly in Canada's Canadian Institutes for Health Research, to push this strategy for patient-oriented research. So this vision was conceived back in 2011 and rolled out across the country for provinces and territories and regions to develop expertise from an infrastructure point of view, the how to do it, as well as along various health conditions, building expertise across lines in mental health, in diabetes, etc. And those two entities ideally working together to create a patient-centered experience and patient-centered research agenda. And the end result is we'll have a more informed health system, better outcomes, and better experience by us all. So the Ottawa Method Center, based at the Ottawa Hospital, is part of this journey. So we help, again, bring not just within the Ottawa Hospital, but outside researchers and the public and community and patients and those with lived experience together to build those agendas. The principles are that we foster patient-oriented research, that we try to enact best practices. So as you'll hear from some today, that there's other countries that have much more experience and know-how. So we're trying to extract from what they do and enact those best practices here, and to take this philosophy of patient-oriented research and train the next generation. Okay? So we're still at the forefront the last 5-6 years of thinking about patient-oriented research and actually acting on it, and this will continue with future generations. So how can the public and patients contribute? I see them contributing in 4 major ways. Certainly the major, and this is happening today, and you're having a Dragon's Den as well, is that they help shape the research agenda. What's important? What should they, along with researchers and methodologists, be actually acting on? Okay, so again, not those silos of the clinicians knowing always what to study, but involving the public and patients. Okay, so shaping those agendas. And that can be at a very local level, such as this Dragon's Den, or it can be at a more a larger level with approaches such as the James Lind Alliance from the UK, where they bring together in a more focused way all the stakeholders, including clinicians and the public and caregivers, decision makers, to decide through a sort of an algorithm of what's best for the patients and the public. Also defining it patient-centered or patient-oriented outcomes. Okay? Again, not leaving it to just strictly clinical outcomes, but how you're feeling, quality of life, your function, all that's important. And all that has to shape the studies that we do. Okay, this has been a major shift, again, in the last 5–10 years, away from what we say are clinical outcomes to, again, patient-centered or patient-oriented outcomes. And then at the study level, how they should be involved right from how patients and the public should be involved right from the beginning, okay, around the table as an equal partner in shaping that individual study. Okay, and then finally governance. So governance would be within the health system, how, again, the public should be involved in shaping the research agendas for an institution, for a hospital, for a university. They need to be there. So it's great, you know, going through, seeing the program of this forum, Reflect 2017, because it's patient-oriented research in action. It's bringing together researchers, caregivers, those with lived experience to build research agendas. Right? That's what this is all about. It influences us. It influences how we act day to day, how we conceive of our research. Everyone's experience matters. So it's great to see that, and I noticed that in today's talks anyway, you're touching upon what patient engagement means, what public engagement means, how we can help the researchers think about our perspective with their perspective. Okay? And that's great to see. And it's being presented by researchers, caregivers, those with lived experience. That's a wonderful thing. So I say this is patient-oriented research in action. And hopefully this becomes the norm across health research, certainly in Canada. So with that, those that have had vast experience is the United Kingdom. And it gives me a great pleasure to introduce Simon Denegri, who is National Director for Patients and Public and Research at the National Institutes of Health Research in the UK, and Chair of Involve, the National Advisory Group for the Promotion and Support of Public Involvement in Research funded by the NIHR. It's, in some ways, they're miles ahead in the UK, and hopefully we can begin to catch up. And Simon has been influential in consulting with the Ontario strategy for patient-oriented research, and certainly I've learned a lot from what he and others have done in the UK, and it's just fabulous to have you over here, Simon, and kick off with our keynote address. Simon.